what kind of risk would that carry as far as potential mortality and complications?
Well, in most of the time, the surgeons are able to go and close the hole in the heart, and that in per se isn't a big risk in and of itself. The bigger issue for us at the moment is that because he's not stable enough yet to go to surgery, each day we're losing that ability for his blood flow to be maximized, for the oxygen to be getting to the brain, and so on. So it's certainly not improving his condition any. It's probably making it worse. And so the best we could hope for is that maybe he becomes stable in a few days, that our surgeons say they can take him to surgery. So basically, we do have a number of options.
Okay, so what are our options?
Right. Well, we have an array of things, and as I said, on one extreme here, we could be completely aggressive, just continue to do everything, try to get him well enough to go to surgery, and take our chances, and no matter what happens to him, we do the next intervention to try to help him survive.
Taking our chances means that he will pass away?
No, by taking our chances, meaning that no matter, even if he gets worse, we do more things to try to keep him alive, right? If his heart stops, we try to resuscitate it.
Okay.
Because that's quite possible that within, it might not happen, but it could happen at any time that, because he's been so sick that his heart just actually stops. And so again, on one extreme, we can be completely aggressive and then try to resuscitate him and do all those things to try to keep him going, including then taking him to surgery at some point. On the other end of the spectrum, as I say, there are many people who would say at this point, look, this is so severe, his body's telling us that it's asking us to let him go. And so at that point, we would take the breathing tube out so that he's more comfortable. We would focus on comfort. We would take all those needles that we've got in him that are bringing lines and fluids into him, and you'd be able to hold your baby. You'd be able to take, because as you know, he's been in the little incubator there. You've really been separated by him. You've been touching him with gloves through the incubator line, and we would make him as comfortable as possible. You'd be able to hold him. You'd be able to stay with him, and he would pass away at that point because we would stop those life supports. In between, we have a variety of options. One of which I definitely would recommend, which is that if his heart stops, that at that point we say his body is telling us something. It's telling us it really didn't come prepared for a long life. And we do just, at that point, take him off everything and let you hold him because his heart would have stopped. And rather than put him through trying to resuscitate and pounding on his little chest and all that, we try to do that. And, as I say, the surgery decision doesn't have to be made today because he's not ready to go to surgery. But I think that would be another point at which we'd say, do we want to put him through that? Because, again, the surgery itself isn't high risk of mortality if he's stable enough at that point. It really is just that we are cutting in, and surgeons are going into his chest at that point, and we have to say, is it worth it to put him through that for what we think we're going to get?
So do you think there's anything that could happen from now to the next surgery that could, change,
Our options?
Yes.
Well, again, turns for the worse are the most likely things that change the options, the heart stopping and so on. Dramatic improvements at this point wouldn't be likely to be seen. I mean, some things that could happen is if that brain swelling starts going down, so we have the shunt to try to take fluid off the brain. We're not sure why we're getting that swelling. If we were to respond to that and we see that swelling go down, we might have a better shot than assessing the extent of his brain damage because the swelling goes down, he might be more responsible. We'd be able to tell that he's not responsive, and we'd say this is likely to be a child who's blind or deaf. So those kinds of things could change, generally not very dramatically quickly.
Murphy, if he went into cardiac arrest and you did CPR on him and got him back, what would be the chances that he would survive with that to being discharged in the future?
Yeah. Well, with each turn for the worse, it tells us something. The probabilities go down further. And so, with babies, because their hearts tend to respond to resuscitation more than adults do. We might get that heart restarted only to have it stop again within hours or days later. And so, and the probability of that goes up once you've had the arrest. So we would know, in fact, that he, I mean, we always talk about the baby declares, the baby tells us something about which way he's going, and that would be a pretty definitive sign that we're not going to be getting better.
Do we know if he's blind or deaf or, like,
Right now, he's minimally responsive to things like light and sound, and so we think he probably is, and that probably is the outcome of this. As I said, we're a little reluctant to make that diagnosis definitively because there is the swelling in the brain that if it were to go down, we might get a little better feel for this right now. But on the other hand, each day that swelling is there makes it more likely that, in fact, he's going to have those impairments.
When you think about what to do for your son, what do you put the most value on as far as, long term? Is it the fact that he would be alive, would be his quality of life? How do you, in your mind, weigh what's most important?
I don't know, we would like to, see him alive, and we believe that as parents we could, help to compensate and, to help him to live at whatever quality of life he has. If he has a chance, we want to,
We would just feel really bad if we let him die.
Yeah.
I don't think we would be able to live up that long.
Now, when you say you would feel bad letting him die, could you elaborate?
With one of the options, because we do want to hold our baby. We haven't held him since I gave birth, and I think we would just morally feel really bad.
Now, would you feel like as if you were causing him to die,
Yes.
you're killing him?
Yes, I would.
Right. If there was an option where, if he continued to get worse and it became clear that he was going to die no matter what could be done for him, and therapies were not going to change anything, so that there was going to be no chance of improvement at all, no chance of getting any better, would you feel in that scenario that it would still be wrong to remove life support?
I think we would feel a little more at ease just because we did everything we could.
Okay. So what I'm understanding is that at this point you feel that even though he's very sick, you want to continue care, but you would be open, depending on his status in the future.
We don't want him in pain.
Right. Okay. Dr. Murphy, do you think that he is suffering as far as pain goes at this point?
Well, we certainly tried to medicate him so that he to keep him out of any serious pain, but certainly the things we're doing to him do not make someone comfortable. If you imagine if you had a tube down your throat putting oxygen into your lungs and occasionally you tried to breathe over that, it would be uncomfortable to you. You know what a needle's like in your arm, right? We have many lines going into him to bring him fluids, to bring him his medication. So again, I don't want to really say he's in pain. I would say that clearly we're causing him discomfort. There's no doubt about that. And like any baby, he does desire the stimulation of being held and nurtured, and we're minimally able to do that at this point through all that. Although, I see a great deal of parents who are in there trying to, with the incubator using the gloves. But we're certainly not making him comfortable with what we're doing to him.
So if he were to live, do you think that he would get those same sensations and satisfaction that any other child would get from being held and nurtured, or would it be different because of his situation?
Well, and that's hard to say, right? Because, none of us have ever been blind and deaf and, unable to use some of those senses to communicate that we use as part of that, right? Obviously, he's able to feel touch, But even with his brain impairment, there's a minimal ability to respond to that because he doesn't have the motor skills. So certainly being held would be something I would imagine is pleasurable. But if as I say, right now he's minimally responsive to light and so on. So he's not like going to be able to recognize faces and have that kind of pleasure of seeing a parent's face that most babies have.
And that's for sure.
Well, at this point, and very likely. But as I say, a few more days of seeing if having the shunt brings the brain swelling down would tell us a little bit more. But at this point, things are not looking good.
Dr. Murphy, can I ask a clarifying question? If Brian makes it and he's obviously going to be with us for some time, would he go home on a breathing machine, or will his lungs develop and he'll be able to breathe?
That's extremely hard to say at this point. It is possible. I mean, a best-case scenario is at some point that brain swelling goes down, he's able to breathe on his own, we can take him off the vent and send him home. But it's at least as likely that, in fact, he will need some kind of support for a long time. In that case, we would either have to look at home ventilation, which at an infant age, it's not a big issue. But and this is why we're having this discussion, because these are problems that get worse as you get old, as a child grows, right? Because it's one thing to, as you see right now, that tube's smaller than a straw that goes down his throat. If he were to survive into teenage years and he were not able to ambulate, still need ventilatory support, then you've got a big machine and you've got to hook it up, and either it drives on the wheelchair with it or it sits next to his bed. So these problems grow with the child to some extent, and that's why we want to have this discussion now.
Have you met with the social worker in the NICU?
No.
No, okay. All right. That's a very important person to talk to, not so much for what's going on right now, but for the potential future. If your child does survive and then requires a number of therapies at home, the social worker would be actively involved in helping you arrange that. Another question I would have is, what kind of support do you have from family to help you take care of your child? Because this would be a 24-hour-a-day undertaking that would make it very difficult to have a normal family life. Somebody would have to be there constantly. It may make it difficult to work. So do you have family support services?
Yes, our parents, both our parents are very involved.
Okay, that's good. That's very important. And I think that has to be part of what you bring into the decision making. It's not, obviously something that you want to say, I don't want to continue care for my son because we don't have adequate resources, but you have to look at the whole picture, and you also have to look at yourselves and what's right for him and what's going to be best for your family overall. And again, as I said before, there's no right or wrong answer. It's really what you believe would be the best. And also, since we're dealing with a newborn here, we're unable to make decisions based on what he would want. If any one of us got sick, people would make decisions based on what we had said in the past, or maybe what we had written down, or our loved one would make a decision in our place, thinking as we would. But we can't do that with your son. So you have to look at what would be in his best interest. And that would include both life and quality of life. And how you're going to weigh those decisions. It's a very difficult thing. It's not something that's cut and dried. And for a child that's facing very, very severe disabilities for the rest of his life, quality of life becomes a major part of that decision-making. Is there any questions that you have that have come up with our discussion so far that we can help you with, or that you think that are important to this discussion?
I don't have anything to you.
What I sense from the two of you is that up to this point, you want the care that the treatment that we're providing right now. We're doing everything we can to keep Brian alive and to keep him moving. But that you also seem to understand that if something natural happens, like his heart stops, that you would feel like it wasn't you making the decision, but rather Brian's body is making the decision to stop. Would you, do you think you might be willing to, if his body does tell us by stopping it, his heart stops, that you would be willing to, make that hard decision to let Brian go, to have your baby die, because there isn't more medical in it.
I just want to do everything that we can, and if his body does react that way,
it's telling you something.
It's telling us something. I see that as a sign.
I think you're being very courageous in understanding the reality of if Brian does make it, your life is going to change dramatically. And I think that none of us can fully understand that sitting at this table, but I think you're starting to think about what that looks like.
Another thing to think about when you're making decisions is that the decision you make today, it does not bind you in the future as far as you have to stay one course. And I think at this point, from what I understand, you want continued care, at least aggressive care, in the near future to see what happens, and with the hope that he improves. And again, we all hope that happens. But there is realism that the disease is very severe. If he gets worse, a decision to be aggressive today can always be changed in the future, so that if you see, despite all the therapies, as condition is continuing to worsen, and that he is suffering without any real benefit, that decision for maintaining therapy can always be reversed. So a plan that's agreed on today as far as maintaining care goes is not set in stone. So it gives you options. That, as Dr. Murphy said, there's a wide variety of paths that we can go on, from doing everything to doing just comfort care, or something in the middle. And what I read is that at this point, you want to continue being aggressive and give it some time and see what happens.
Yeah.
Is that correct?
That is correct.
I don't want to put words.
No, it is.
Okay. How do you feel as far as that as an option?
I think that makes sense, and I appreciate your thoughtfulness in this. And so what I'm hearing is that I could enter a do not resuscitate order, so that if his heart were to stop, we would say, okay, then Brian is declared for us, and that's fine. And as you say, we don't have to really do more than that at this point. But I would say that within a fairly short amount of time, meaning days, if I'm not seeing improvement, if he's not stable enough to go to surgery and get the heart fixed, if the brain swelling's not coming down, not improving is in a sense getting worse at this point, because that would mean that his brain is under pressure. We should then, we need to reconsider again and say, which way is he going for us?
Well, since today is Wednesday, would it be unreasonable to say that Monday we sit down again and revisit where things are, reassess at that point, and continue the conversation? If he has dramatic decrease in his condition, it may be more clear what the path should be. If he improves, then again, that may be time to reassess, a higher level of care. But I think, periodically looking at his status would be the best thing at this point.
Okay, so we've decided that you're going to enter the do not resuscitate order. We're going to continue with the breathing machine and fluids and nutrition, and reconvene, or you'll stop by on your rounds and talk with the parents, talk with you on Friday to reassess if Brian is stabilizing or not, and then we can have a further conversation. You said you have a pastor that's been praying for you in a church community.
Yes.
So if you need additional spiritual care support, we have chaplains here, especially in our NICU, and we can make sure that chaplain stops by to see you. And you're going to have the social worker stop by.
Yes, we'll have that discussion with you as far as the long-term planning, so that if that is the final path, that process will be started.
That would be great.
Thank you for your courage in this, and